Hey there. Um, it's been a little longer than I wanted it to be between updates. There's just been a lot of life stuff going on, and we had a trip kind of mixed in. So I'm about 5 weeks out from my CMC arthroplasty and oh, what is it? Tendon transfer. Um, and so I was supposed to be in the hard cast for another 2 weeks. But I kind of talked to my PA into letting me go ahead and go into the splint, mostly because it's really hard to care for myself in the cast. I bought a really nice cast cover on Amazon, and I will drop the link below because it actually is really awesome. They say waterproof. I don't know that I trust 100% waterproof, although I did get in a pool on vacation, and my cast did not get wet, but it didn't submerge my arm completely either. So do with that what you will. They do say it's waterproof, but it is great for showering. However, you need help putting it on. It's super tight. We call it an arm condom. Um, so because of that, I couldn't shower when I wanted to shower, and it was really kind of driving me mad. And I'm kind of a bad patient. So the PA said that if I promised to treat the splint like a cast and only take it off to carefully shower, and occasionally, if I'm sitting in my recliner doing nothing else, I am allowed to take it off. But I've been really good, so I got it on Monday, and I've done exactly what she said. I'm treating it like a cast. So I'll show you. Here's my that's my splint. It's actually pretty comfy. I'm not really having any issues with it at all. I will show you. So my recovery has been great. So this is my surgery hand, and I don't know. Well, yeah, you can see right there where my incision was. It's healing up just beautifully. Um, and I'm really not having any pain. So there's the tops of my fingers. They denerved both of these fingers. So it looks a little gnarly still, but nothing like what it did look like before the sutures came out. And then here's the bottoms. So yeah, I think they're looking really good. They don't really hurt. I don't have a ton of bend yet, but I'm working on my physical therapy. So they have me straightening. So that's one of the exercises I do. That one doesn't feel the best. And then this claw thing, I do that 3 times a day. And then I do the tabletop. That one's pretty easy. I wiggle them a lot. The only thing is just the bend, but they're still really swollen. I don't know if you can tell. I mean, compared to, here's my other hand. I mean, they're pretty swollen still. So it does still hurt to bend down, but that's pretty good. That's pretty good for 5 weeks out. So I'll take it. Um, so anyway, yeah, the waterproof cover, like I said, I'll drop a link below because it really is awesome for showering. Um, I thought it was worth the money. I think it was $40-ish. So yeah, things are going really well. I can already. I couldn't do this a week ago, so that's pretty exciting. I can kind of pinch, and if my thumb weren't off, isolated, I'd be able to do more. But that's one of my exercises also is to try to move all my fingers towards my thumb. So at 5 weeks out, it was definitely worth doing. I know, like probably many of you, I went back and forth for quite a while. Do I want to do this? It's very scary for me to have surgery on my dominant hand. Um, I was really worried like I wouldn't be able to write. I don't know why that particular thing stuck in my head. Like, what if I can't write anymore? I don't think that's going to be an issue because, like, I mean, I am getting a lot of movement. She did say my pinch strength will not be great after this procedure, which I didn't really care about. She said I should be able to write. That's really all that matters. I don't really do anything that requires pinch strength. So I can already type. I've been practicing that without using this thumb. I'm able to type pretty decent. So all in all, yeah, I definitely am already at the point where I see that it was the right call. It was definitely worth doing. I feel really good about it. We do still have to do this hand. And I had thought I would do it once I was in a splint on this side, but now just living life since this procedure, I know that's not going to be possible. It's just too much. So I'm going to have to wait until after some PT, and really be back to using this hand somewhat normally before I do the other hand. Because I can't imagine if both my hands were out. I will say, though, that I'm overusing my left hand, which is making my arthritis pain way worse. So I'm having a lot of issues on that side. Um, so something I haven't really gone into a lot, that many of you may not have issues with, but I have Ehlers-Danlos. I don't know if I mentioned that in a previous video. I think I may have. I have hypermobile Ehlers-Danlos syndrome, which I just refer to as EDS, and I'm in a very advanced stage of it. While I just got diagnosed about 2 or 3 years ago, I've been having joint issues, like severe joint issues, for probably close to 15 years. We just didn't know what was going on. So I've had, before my diagnosis even, both Achilles reconstructed, which is a horrible recovery. I feel like I have PTSD from having my Achilles done. I can't even tell you how terrible that recovery is. But I've had both those done. I've had multiple knee surgeries. Um, I've had issues with my hands for at least 15 years with my thumbs. But yeah, found out that I had EDS a couple years ago, when I was already way advanced. Not that that mattered so much, because there is no treatment, there's no cure. You just kind of treat symptoms and fix what breaks. So I've had a lot of surgery and have a lot of surgery to have still. So at the same time I'm going through this recovery, I just had my left shoulder reconstructed, which also complicated this situation. But I had my left shoulder reconstruction done about 6 weeks before I did my hand. So my left side's not strong yet either. My left hip is really painful. So I just had imaging done for that. And I have several labral tears in my left hip, as well as a couple of gluteal ligaments that are torn. So I'm having a really hard time walking. Walking is very painful. So I see a surgeon on the 11th, about my hip. So probably going to be having a hip replacement soon. Still have to do a knee replacement on my right. I've had the one in my left knee replaced, as well as a revision to that replacement, to further fix my kneecap. Probably having a spinal cord stimulator put in. Yeah, so still have a lot to do. So life the last several years really has felt like surgery, recovery, just endless surgeries, which gets very frustrating. It's hard to stay on top of it mentally. I live with a lot of pain daily, so that gets tough. But I'd still rather be here than not. So I deal with it most days. I deal with it pretty well. But it is daunting knowing that I have so many surgeries yet to do. And I feel like I was lucky. The last two were pretty easy recoveries. This has been really a breeze. I think I took pain meds for a day with this hand surgery. So anybody out there who's contemplating doing it and maybe scared of the pain or scared of the recovery, I was way, way more scared of this than I needed to be. Now, I know everyone's different. Maybe not everyone's had the same experience I've had. But man, it has for me just been such a smooth recovery, other than not being able to use my dominant hand, which is difficult. But pain wise, really no pain at all. Even when I try to bend my fingers, I don't have pain. I just feel like the resistance, like the skin is just still so tight. But it doesn't hurt. Even when I do so they have me doing scar tissue massage. So I have this little rubber, I forget what it's called, but a little piece of rubber they gave me in PT, that I use to get traction. And they have me rubbing like in a pretty firm circular motion around those scars on both sides. So I do the same thing back here and just really, really rub them, about 3 minutes at a time, 3 times a day. So hopefully they're going to start to loosen up a little bit. But yeah, they don't hurt. They don't hurt. My thumb doesn't hurt. unless I feel some pain in my forearm if I like I've used this hand. I shouldn't have, but I have used it to try to, with these two fingers, to try to grab like a grocery bag. Any weight at all, any pressure on this side, and I do feel a teeny twinge of pain in my arm where they harvested the tendon. So, and I'm not supposed to be lifting anyway. So, yeah, that's that. If you're contemplating doing it, I would say go for it. I've been really impressed with the procedure. Um, Same with my shoulder. My shoulder, I was super, super scared to do. Almost didn't do it because I've heard so many horror stories about shoulder surgery. Um, it wasn't a full replacement. It was just kind of a reconstruction, clean up some stuff, remove some bone spurring. Um, but yeah, the recovery has been pretty easy. So it's been nice. The last two surgeries have been easy ones. My knee replacement was a nightmare. That's a terrible recovery. For me, it was a terrible recovery. Don't want to scare anybody thinking about doing it. But it's tough. It's a tough recovery. Um, so yeah, that's about all I have to say about that. I will in future videos go a little more into EDS for anybody watching who might be dealing with it. Um, it does complicate life. It's tough. I talk a lot and I actually teach a class on dynamic disabilities, invisible disability, because I struggle with just dealing with the rest of the world. When I'm not in a cast or a splint, I don't necessarily look disabled, which brings a lot of challenges because the general public just doesn't get it. But yeah, that's a later video. I won't go into that now. Just for sure want to encourage you if you're thinking about doing the arthroplasty, the CMC arthroplasty. I think it's totally worth doing. It's really not a terrible recovery at all. I can already tell it's better. I can already tell this hand is better. So I'm really glad I did it. And with that, I have gone over 12 minutes. So thank you for staying with me if you're still here. And look for the link for that really cool cast cover below, or the blue arm condom, as we call it. And yeah, I will be back to make another video soon. Have a great day.